It's a call that's telling me I'm here to serve. It's a need to make a difference in the world. 24 hours, day or night, these healing hands will make it right. Looking in their eyes, I know that I'm changing lives, changing lives, changing lives for the better, changing lives.
And hi again, everyone. Jim Knox along with Candace Kruger, and welcome back for another edition of the Best Docs Network, featuring some of the best Houston physicians helping change people's lives.
That's right, Jim, and as many of you know, October is Breast Cancer Awareness Month. It's the perfect time to get to know our next doctor, plastic surgeon Dr. Evan Feldman, who helped one woman diagnosed with breast cancer by providing her breast reconstruction.
October of 2011, I was diagnosed with stage 1 breast cancer and was advised that I needed a lumpectomy with internal radiation. Maybe a gut feeling kind of told me that I needed a second opinion. After looking at all my history, she actually recommended a bilateral mastectomy with reconstruction. So that's what I did on April 3rd of this year.
Breast reconstruction is a very rewarding surgery that we do for the patients. It's women who are going through, some of the most difficult times in their life. They've been given a diagnosis of cancer and been informed that they may lose one or both of their breasts.
I came and talked to Dr. Feldman about the whole process, and of course I was nervous, and I know I even started crying at one point, but he was so supportive and just assured me so many times I would be in good hands and I would love the results. And
so she chose to have an expander and implant-based reconstruction, and that allows her to have a reconstruction that doesn't have a second surgical site. So rather than having to use muscle from her back or from her abdomen and impacting her golf game or her yoga or her active lifestyle, we're able to use implant-based reconstruction, which is a very nice result with really nice technology that's available to us now.
Just fabulous, yes. And he did a great job, and I had total confidence in him. And I've been feeling actually pretty good. I'm kind of wanting to get out and play golf, which I haven't been able to yet, but actually I feel really good.
Every patient has individual concerns, and whether it's lifestyle, whether it's recovery, whether it's, can they get back to their job or take care of their kids, that's something that we take into consideration with every patient. The surgery's gone so well and she's so confident with her results that she wants to be out and move on with her life and put the cancer behind her, and we've really been able to deliver her a nice result that she's able to do that with.
So many exciting things have happened since then. Not only the good prognosis with the surgery, but we're engaged now. Hopefully my daughter will be graduating from college soon, and I'll be able to retire early next year and kind of just move on with my life in a positive direction.
Officer Wayne Schultz weighed an unhealthy 554 pounds until he met Dr. Robert Marvin. To find out more on Wayne's story and other life-changing stories, log on to bestdocsnetwork.com.
To be a comprehensive breast center, it doesn't mean having a nice building and a nice name on the center. There's a lot of people that have done that. What makes you a comprehensive breast center is working with other physician specialties together to do the best that you can possibly do for each patient. It's important that when we find an abnormality, that the radiologist understands the pathology, knows what to biopsy, when to biopsy, and then can communicate that back to the referring physician, communicate it to the patient, and communicate to the pathologist what our concerns are. This is what the beauty is of a comprehensive breast center. So it really means working together as a team, working with your breast surgeons, working with the pathologist, working with the radiation oncologist, the plastic surgeons, and we work as a team. When people come to TOPS Comprehensive Breast Center, or if they come to one of our Memorial Hermann breast centers, what they'll see is a group of dedicated breast radiologists, So when they come to one of our centers, they're dealing with a radiologist who is focused on finding cancer at the early stage. And one of the things that we talk about as a group, we want to disrupt as few lives as possible while finding cancers at their earliest stage. That's our mission statement. If someone comes in and we have a finding on the mammogram, or they come in with a palpable lump and they need an ultrasound. In many facilities, this is performed by a technologist. The doctor may or may not ever see the patient. If they do see the patient, they only look at the area of interest. It is our policy in our practice that radiologist comes in on every patient. We scan every patient ourselves. Yes, our technologists look, but we scan every patient. My strong belief is, and I think statistics prove that, is that when you have specialists doing this, you get a better result. In our practice, that's what we do. That's the whole focus of our practice. You know, it's a very special group of people from all over the country, from very well-trained facilities, and so it's an exciting group to be part of.
Many of us live with pain, but you don't have to. PAMA's here to help. Whether it's sports injuries, arthritis, or joint pain, the physicians of PAMA are dedicated to your wellness and getting you back to pain-free days. So what are you waiting for? Go to PAMAinc.net and find a physician or orthopedic specialist who can help you stop pain and live life to its fullest again. PAMA, pain freedom. Go to PAMAinc.net.
Pretty much allergies has been pretty much since I was born. And then I guess it really came in more in focus when I was diagnosed with asthma when I was 2 years old. And because my asthma is allergy triggered, and basically it's been pretty much a full battle since then.
In the case of asthma, what you have is an inflammation that takes place inside the lung. And this is a normal lung here, which is nice and pink and open. And when a person has an asthma attack, they have a muscle that just actually contracts, and it causes all of the inflammatory cells to come in, and the mucous membranes get very thickened, and over time they can actually become fibrotic and they're scarred. But the real important thing to notice is how red and angry it is compared to the other side.
You know, as a kid, back then, as you know, I just didn't have the knowledge or understanding of what was happening. It's just I knew it's like if I gone outside, did things, any activity, it was like my allergies start kicking in, then which then caused my asthma to trigger. I would really hinder my activity as a kid.
But I actually came into Kenny's life in 1997. He was 13 years old, and he weighed 285 pounds. And he was homeschooled, I believe, shortly thereafter because he was sick so much with his asthma that he couldn't go to school.
Yeah, between the asthma and allergies, I mean, everything was just haywire. I mean, it's like literally we're trying different combinations of meds every few months, because just trying to find that right combination, and finally found that right combo, and it's been pretty good so far.
We got him well controlled, and now we're trying to put him on allergy shots so that we can eventually get him off the Xolair. And hopefully, with the weight loss and everything else, he will be on very little medication.
Especially with Dr. Dickens, I mean, she sits down, takes, walks you through everything. She takes, time. She doesn't rush you through, or you're not just a number. I mean, she really gets to know you, gets to know your history, and just that personal one-on-one that I don't see with other doctors.
We all worry about cancer. How can you tell if you have cancer? Here are some warning signals: unexplained weight loss, trouble swallowing, an unexplained and prolonged cough, a thickening in your breast or any other part of your body that hasn't been there before, a change in your bowel habits, night sweats where you drench your sheets every single night, not just now and then when you're hot, a change in a skin lesion in color, size, or shape, or abnormal bleeding or discharge where there shouldn't be bleeding or discharge. Keep track of these signs and symptoms. The problem is some cancers don't show those signs or symptoms. The only way to discover them is to have your examination done by your doctor. Blood work can give you some signals about cancer. It may not tell you what cancer you have or if you have cancer for sure, but it can give some warning signals to help you get sort of a heads up on things. The blood work really is very helpful in helping you figure that out. So eat right, eat your vegetables, and you can avoid cancer.
People go for snoring, but they need to figure out if they're treating snoring, if they're treating a real medical problem, like sleep apnea, so that they treat the cause of their snoring instead of the noise.
Dr. Ludwick's in-house state-of-the-art sleep lab allows him the opportunity to evaluate his patients in a comfortable setting.
Well, people don't come see me for a test, okay? They come see me because they feel a certain way, and they don't want to feel that way anymore, or they don't want to have this symptom like snoring anymore. They don't. Testing is a means to an end. It's a means to understand what is going on with you so that I know how to treat you, okay? So we have to have the test to know if I'm treating someone who just makes a noise or someone who actually has a medical condition that causes heart attacks and strokes, and as you saw in the nightly news, if you watch the nightly news, increased chance of cancer now. So it's a real medical problem. So I do the testing. The testing is necessary for the treatment, okay? Once we decide that you need treatment, let's say for sleep apnea, then we got to figure out how we're going to treat you. There's lots of different treatment options. There's surgical ways to treat sleep apnea. There's non-surgical ways, and it just depends on the person, their anatomy, and their overall health status. Which way that we want to help them. And the good thing about coming to an ENT that does sleep is that sleep apnea is an upper airway problem. It's not a lung problem. Okay, you don't have a lung problem. You have a can't get the air to your lung problem. Yeah. And so that's why it's good to go to an ENT, because then we can address all the anatomic issues you may be having, because these guys have other things like deviated septums or big turbinates or big tonsils or huge palates, big tongues, things that we can help surgically manipulate those structures so that they're not causing obstruction, or if they are causing obstruction, cause less obstruction. And that's the benefit. And also use these other non-surgical techniques like CPAP or oral appliances or things like that.
From initial testing and evaluation to a successful treatment plan, Dr. Ludwick provides his patients with a one-stop solution.
That's the purpose of us building a relationship. It's not something we fix in one visit, it's a journey, and we're gonna evaluate you, find out what the problem is, pick some options, and let's see how you do, and then we can always change the plan. It's not written in stone.
If you've had a doctor help change your life, we'd love to hear about it. Send us an email at info@bestdocsnetwork.com.
Well, I'm an ultra runner, and my skin, as I've aged, has gotten extremely thin. My fat level's very, very light because I'm an ultra runner, so I spend about 70 miles a week running. And I was getting wrinkles all around my face.
Pam is actually my nurse anesthetist who's been working with me for a number of years and has had an opportunity to see work which I've done on other patients. She had some redundancy of skin in her jowl and lower neck and cheek area, and she's very thin but has lost elasticity in her face.
I talked to him, and then I waited about a year and tried to think if this was something I wanted to do or if it was something that I could live without doing. And because I run 100-mile marathons, I honestly don't feel 56. So when I would look in the mirror, I could see a lot of my face just almost falling off. The skin was just so thin.
We're actually providing fat and transferring it from one area of the body to another, not just as a filler, but as a method to rejuvenate her face. And we're doing this with a transfer of fat with stem cells. And so this is a kind of a new technique which we're using now for individuals like Pam.
Totally happy and satisfied. I am very grateful. If you pull out a picture of me back when I was in college, it just looks like I'm an older sister, and I love that. I don't want to look like I'm in my 20s and 30s, but looking like I'm in my 40s, that's okay.
Patients come in, they basically want to look as good as they feel. They sometimes will ask, am I too young to have this done, or am I too old to have this done? And basically it doesn't matter. Basically, if they are physiologically fit and psychologically appropriate, then they're good candidates for surgery. But it has nothing to do with your chronologic age, clearly.
It's been wonderful, but the best thing about that is I feel good about myself. You know, I take a lot of time in maintaining my health, and I feel young. And now I just feel like I look young.
For more information on any of the doctors you've seen on today's show, just go to our website, bestdocsnetwork.com.
That is also the place to go to find the doctor that may help your needs. Right now, the place to go is our next doctor, bariatric surgeon, Dr. Robert Marvin.
You know, my teenage years and my 20s, it's been difficult. I've been able to interact and do things with people, but without difficulties. Right now, I just have like muscle and bone problems and things like that, but no like diseases or anything. That hasn't affected me in any way.
When a patient gets over a body mass index of 50 and Mr. Sowell's at a body mass index of about 74, he does not have a normal life expectancy because of his weight.
You know, with dieting, you can go out and you can still eat a ton of food, but with the surgery, you try to eat those things, you know, and you have physical problems. You're not able to eat that much as you would to put the weight back on. So the fact that it keeps you in check, but yet it's still, you know, it's not something that you want to abuse in any way. It's something that you really want to take seriously, that you know, you're ready to live a normal life, you know. I mean, when you're like me and you're almost 30 years old and you've had difficulty, you know, having fun and doing things, you know, it gets where it's tiresome.
Well, Mr. Sowell does not have insurance coverage for this operation. And even if he doesn't have any insurance coverage in the future, if he were to develop the other medical problems related to his obesity, he is going to get treated in this country, and it's going to cost a lot of money. So really we're looking at a time bomb in terms of resources necessary to take care of him. And there's nothing else short of this operation that's going to make a significant difference in terms of his weight. There just isn't.
Because, you know, there are so many people that battle this in their own life, you know, being overweight, being obese, you know, and we all know, anyone who's struggled with that knows how difficult it is and knows how tiresome it can be. Through this surgery, there's a way to get past that. There's a way to feel good. There's a way to have a normal life and so forth.
This is the best shot he has at getting control of his weight, and this is overall probably the lowest cost way to do it. And that's really not generally recognized, but that's the truth.
Kimberly, who loves to travel due to her job, could hardly walk due to severe foot pain until she met Dr. Gabriel Maeslos. To find out more about Kimberly's story and other life-changing stories, log on to bestdocsnetwork.com.
Probably for the better part of 10 years, when I would cough or sneeze, I would release urine.
The leaky bladder is extremely common, and I think one of the biggest issues is that women just don't like to talk about it. They think they have to put up with it, or they're somewhat reluctant to talk about it in the office to their doctor.
It finally got to the point where it was interfering with stuff. I had to carry extra underwear and clothes to work, or I'd have to go home in the middle of the day, and it was I don't think anyone ever noticed, but I felt embarrassed and uncomfortable, and that was what finally made me decide to get tested to see if my problem was due to the incontinence that this would fix.
The procedure now is also a minimally invasive procedure, and it involves placing a small piece of mesh underneath the urethra. That's the tube that goes from the bladder to the outside, and it forms just a hammock or sling underneath the urethra, and when placed correctly, it has an over 90% chance of success.
After I had it done, I told Dr. Leibman I wish I had done this 5 years ago, because it made that much of a difference. But I thought I was too young, and so I convinced myself, oh, you don't have this, it's something else. This isn't going to fix your problem, and so I just didn't ever talk to him about it. So I should have talked to him sooner.
The recovery is also just wonderful. It's done as an outpatient. This procedure is still done as an outpatient in a outpatient facility or freestanding outpatient clinic, and the patient will go home Again, have something to eat, maybe take some pain medicine, but very little discomfort associated with it.
I sneezed, nothing, not a single drop. And it's been 2 years now. I mean, it's completely changed my life.
Very little discomfort associated with it. And what's really nice about it is that it's effective immediately. If it's going to work, she'll tell you the next day she hasn't leaked, much to her surprise.
My teeth needed to all be extracted. They were crumbling, they were breaking, I couldn't chew my food.
He's a professional, an accountant, and he's certainly concerned about finances and how to structure his budget. And he was a guy that his lower teeth were worse off than the uppers. And so that was an area that he decided to focus on.
I guess this started in 2009, and this really happened in two settings. So that in 2009, we did the lower, and in 2011, we did the upper. The bottom is all done, and I'm in the midst of having the prosthesis on the top done.
And also with David, his concern regarding his budget, we were able to do this without grafting. Previously, in the upper jaw, because of the maxillary sinuses, we would have to graft those areas. In majority of cases that we were placing a full jaw worth of implants. But with the advent of cone beam CT, we're able to look at individuals from a three-dimensional standpoint radiographically ahead of time so as to know where the bone is, so that we can position implants within that bone and avoid the need for sinus grafting, and then subsequently lower his overall costs significantly, as well as increase the predictability.
No longer do I have to make sure that everything is in place where it's supposed to be in place. I have a new chance at a brand new set of teeth, and they don't hurt.
It's satisfying to see him come back smiling, see him walking down the hallway, standing upright with their chin up, smiling, and being much more confident. So from a psychological standpoint, outside of the health benefits that you see, the mental health benefits are significant.
I'm a CPA. I meet with clients and high net worth clients. Appearance is important to me. It's certainly not of the utmost importance, but it's important to me. And I don't want to be embarrassed by a crumbling smile line. It's a wonderful, wonderful solution.
12-year-old Kyle loves to play baseball, but it was hard to do due to allergies. That is until he met Dr. Lynn Dickens. To find out more about Kyle's story and other life-changing stories, log on to bestdocsnetwork.com.
Here at Revella Plastic Surgery, we perform plastic and reconstructive surgery. We emphasize aesthetic procedures, primarily of the breast, body, and face. The ideal candidate for a breast lift would be a woman who's completed their childbearing, their breast changed during pregnancy or during lactation, and they have perhaps stretch marks, excess skin, and they've lost a lot of the fullness in their upper part of their breast. So typically they're going to want everything lifted as if what a bra can do for them, and that may involve an implant or without an implant.
After birthing 3 children, I needed some help, so I came and saw Dr. Revella. I knew some people in the area that have had his work done, or had work done by him, and so I was pleased and came to see him as well.
Amy came to us with sagging breast and after children. She wanted them uplifted. She wanted to be able to wear certain tops and clothing that looked perky without being saggy, and having to wear special undergarments that were cumbersome or bulky. So what we performed was uplift with implants, and she's turned out very nicely, and she's happy with the results.
I had friends that after I had it done looked like I had lost 10 to 15 pounds, and I had done nothing different with my eating or anything. It was just the way that the top of me was carried before versus after.
It's a fairly quick recovery after a breast lift, and it takes maybe about a month to 6 weeks to get back on your feet feeling like like you did before.
The entire office staff is wonderful. They are all very helpful. He's super nice. He is very informative, very helpful. We'll take your calls if you need to ask him any questions. He is there if he can't answer them. His nurses are there and available to you, but he is great as far as explaining everything and being there when you come out of your procedure to make sure you're okay. Yes, I would recommend Dr. Rovella. He is wonderful as far as his help and the courteousness of his staff, and his results are fantastic.
Everyone should have a complete physical every year. There are 4 important parts to a complete physical. There's the history. Your doctor will ask you about diseases that run in your family and diseases and problems that you may have had, including surgeries that you've had in the past. Then there's the physical exam. The physician will look in your ears and your throat, listen to your heart, check your thyroid gland, push on your stomach, check your reflexes, and check for moles and other problems that are important to find at an early stage. Then there's the lab work. We do a lot of lab tests during a complete physical, and the reason for that is to pick up everything from cancer to cholesterol. And then the 4th part, and this is the important part, the physician will tell you what is particularly important to you to stay healthy, based on your own history and physical and lab work, as well as just in general for the population. For example, should you be on vitamins? How much exercise should you get? What should your weight be? So stay healthy. Give yourself the gift of a complete physical.
If you've had a doctor help change your life, we'd love to hear about it. Send us an email at info@bestdocsnetwork.com.
What we want to do is try to help a woman get through this time frame with the intense symptomatology.
According to Dr. Meredith Morgan, intervention and management needs to be tailored to the level of severity.
For mild hot flashes, home remedy self-management techniques are effective. For some women, yoga will work. Other women, strenuous exercise. On average, you can't say that either one of them really works for everybody, but if it's good enough for an individual woman, it's good enough, and that's all she needs. There is a technique of breathing that's derived from transcendental meditation that actually has been studied quite a bit and found to be quite effective. There are 2 sets of data on the research, and there are different sets of outcomes and benefits and hazards involved in using hormones. In general, we try to start with a low dose and let the patient titrate up to a level that will produce a circulating estrogen level that's satisfactory for her response.
Now there are concerns with hormone therapy. What Dr. Morgan would like to point out is that there are 3 major concerns against the others.
First, breast cancer. Everybody's concerned about breast cancer. Second is heart attacks, and that's serious. But the most common one that we really address all the time is estrogen, and there's been very little historical interest. Your question was, what are we doing now as opposed to 10 years ago? We really haven't changed much in our concept about blood clots. For that reason, our preference is to try to use the non-pill forms of estrogen as much as possible. The pills go through the liver and, simply put, can increase blood clotting chemicals and the risk of blood clotting.
Now the most common question for most women for Dr. Morgan is, how will I know what I'm going to be confronted with? Well, the good news, according to Dr. Meredith Morgan, is that menopause is controllable.
Basic message I'd like you to get is there are many ways to approach this. This is not going to be incapacitating. It's controllable. Maybe the control is the goal, but we're not going to have terminal hot flashes.
That'll do it. That'll wrap up another edition of the Best Docs Network, featuring some of the best doctors in the Houston area that, of course, help change people's lives.
That's right. And for more information on any of the fine doctors that you've seen on today's show, head to our website at bestdocsnetwork.com.
And if you have a question or comment for us, or if there is a doctor that helped change your life, we'd love to hear from you. Send us an email at info@bestdocsnetwork.com.
So long, everyone. We'll see you next week.